Cranial sensory motor dysfunctions in long COVID and COVID vaccine injury patients. Persistent vision problems after COVID linked to ongoing inflammation and nerve damage, affecting approximately 1/3 of long COVID patients. Are dormant virus reactivations linked to these ocular pathologies? In prior YouTubes on this channel, we have discussed the potential reactivation of herpes-viruses as well as human endogenous retroviruses from the glial cells that compose the perineurium, the connective tissue sheath that surrounds bundles of axons in peripheral nerves as well as cranial nerves. In terms of pupillary dysfunctions in long COVID, these connect to the ciliary ganglion, which controls the muscles that affect pupillary constriction as well as lens accommodation. Herpes simplex virus 1 can reactivate from autonomic ciliary ganglia independently from sensory trigeminal ganglia to cause recurrent ocular disease. How prevalent is HSV in ciliary ganglia? In a study of cadavers of people between 50 and 100 years of age, approximately 40% of the ciliary ganglia were infected with HSV-1. In contrast, approximately 25% of the ciliary ganglia in these cadavers were infected with VZV, varicella zoster virus. How can the reactivations of HSV-1 and/or VZV in cranial nerves alter ocular movements? This 2025 paper reports an unusual infection or inflammation of extraocular muscle to produce strabismus. Reading from the legend of this MRI, orbit magnetic resonance imaging revealed left optic perineuritis with left inferior and medial rectus edema, without any evidence of midbrain involvement, either of the third nerve nuclei or third nerve bundles within the midbrain. The patient's strabismus is also almost certainly related to the inflammatory changes in the extraocular muscles. Can VZV infect muscles? Yes, rarely. Now turning to pupillary dysfunctions. These are referred to as tonic pupil or fixed pupil. This is a case of a carcinoma treated with radiation affecting the ciliary ganglion. So arrow points to the expected location of the left ciliary ganglion post-radiation to a neighboring tumor. The patient has tonic pupil in the left eye as a result of the damage and inflammation of the ciliary ganglion. An inflamed ciliary ganglion is rarely visualized as an isolated finding on MRI due to its size, about 2 millimeters in diameter. But high-resolution MRI can reveal it. So in the case of long COVID patients, can inflamed ciliary ganglia be visualized with high-field 7 Tesla MRI in ocular long COVID patients who have tonic pupil? A standard clinical 7 Tesla MRI typically achieves a high spatial resolution of about 0.7 to 1.0 millimeters isotropic, so it should be possible. With MRI diagnostics on the horizon available to identify inflamed ciliary ganglia, what type of therapies can be brought into play for these patients, these types of cranial nerve injuries? On this channel, we have been discussing dry eye disease treatments that could be potentially repurposed for these types of injuries. These include the kidney metabolite of vitamin D3, calcitriol, which has been found to inhibit dry eye-related corneal inflammation both in vivo and in vitro. In addition, I would like to draw your attention to this clinical study published in 2024. Calcifediol, the liver metabolite of vitamin D3, and pericalcitol, a synthetic analog of calcitriol. Calcifediol and pericalcitol as adjunctive therapies for HSV-1 keratitis and corneal perforation. These vitamin D receptor agonists were used in conjunction with standard of care acyclovir for this HSV-1 reactivation. And I would also like to draw your attention to this paper from 2010, showing that HSV-1 is not only a neurotropic virus, it is also a gliotropic virus that is capable of infecting perineurial cells of the perineurium, in this case, the trigeminal nerve. Finally, I'd like to emphasize that calcifediol and pericalcitol can be used in tandem, and it's likely that calcifediol and calcitriol could also likely be used in tandem to help suppress reactivated HSV-1 in long COVID patients. I encourage you to consult links to other YouTubes on this channel in the notes to this particular YouTube.